Good afternoon, everybody. It is Friday. It is the 22nd of April. You're here at Lunch and Learn. Hoping you're having a good week. And today, as you know, we have a guest speaker, and that's Erik Peper here from the Institute for Holistic Healing Studies. Erik has a blog. He has been doing workshops, especially at AAPB and some for ISNR for many, many years. And when he and I were talking about a topic, he said, I have so many different topics, but let's go have some fun. So today his topic is Your Mother's Right, Sit Up and Breathe and Transform Tech Stress into Tech Health. And Erik, we've been talking about technology. My favorite saying base between social media and technology would be the death of all of us. So at any rate, we're going to turn this over to you. Thank you so much for your time this afternoon or this morning in your case, Erik, and it's all yours. So we're going to go for about 30 minutes or so, folks. Then Erik will say, I'm ready for questions, and then we're going to go into open discussion. Here you go, Erik.
Thank you so much for the opportunity and introduction. As you can see, we started on the left here as a little monkey or whatever ape, and we moved up through life. Here we're sort of a healthy hunting and gatherer possibly, and then we end up sitting in front of the computer, and now our posture has changed. And in fact, that data is totally correct, believe it or not, in my colleagues' studies in Canada with young athletes, that if they look at the spinal structure of young athletes now, who are now in college, and their curvature in the spine is now different and worse than it was 20 years ago. So not only by sitting by the computer like this, it literally, the concept is how we use ourselves, develop structure, and structure constraints and limits function. So there are a couple of things about these, and there are many ways we can look at that, but there are two intrinsic processes, I think, which are hidden in the background, which we sometimes forget about. And I would say breathing and posture are mind, body, emotion bridges or reflect each other. In the whole world of bio and neurofeedback, we know body affects mind and emotions, and mind and emotions affect body. If I summarize it very quickly for the talk, I would say that we have really underestimated how breathing in a very subtle way affects us. And if we can change breathing during the day, not just for the 20 minutes, which is often the focus of HRV training. You sit for 20 minutes or 10 minutes, breathe perfectly, 6.5 or 5.5 breaths a minute in resonant frequency. That is only one small part of it. The key is to observe how your breathing changes during the day and during actions and during anticipation. And once we observe that in patients, you realize, they're much more dysfunctional. And the same thing would be true with posture. They run underneath it and in the background. Let me just make one more statement about breathing in pure physiology, and we can talk about breathing in terms of hyperventilation or rapid shallow breathing. And then we need to remember that subclinical hyperventilation, I'll call that is chronic slow breathing, also interacts with glucose levels in the bloodstream. And so if you look at very early work of the 1950s, when you monitor the brainwave activity of a person, and now you infuse them with sugar. So it's like a sugar tolerance test, except much more extreme. Then you record the brainwave activity when they're sitting. In that studies, the mean frequency would be 10. The person sitting peacefully. Their bloodstream is very high in blood sugar, massively high. Now you purposely have them hyperventilate for 3 minutes, which is really not healthy to do, by the way. Probably we can't do that study easily anymore, but they really hyperventilate, and you see no change in the EEG. The frequency stays the same. Then you wait 2.5 hours later. After 2.5 hours later, what has happened is this major bolus of sugar going to bloodstream has given a massive insulin response. The insulin withdrawal essentially takes out the blood sugar. Now the blood sugar 2.5 hours later is much too low. Now the person again sits, you look at the EEG, it's still about 10 or 12 with their eyes closed. And now once again, you have them hyperventilate. And then in the 3-minute period of hyperventilation, the mean EEG drops to 4 hertz. Because when the blood sugar is very low, the EEG becomes much more reactive. And all of you and most of us have had the experience, especially if you work with students, which is my large population, that they have an experience called hangriness, anger and hunger. Really, it's an indirect, you could say, hypoglycemic response. Then if you're irritated, you may be more shallow breathing, which then lets the EEG frequency, depending where, decrease, and you have much more impulsive behavior. So I always keep that in mind of the physiology of breathing. That's purely how diet and breathing are highly interactive. And when I talk about my students, and I teach at San Francisco State, so each semester I have anywhere between 180, this semester fewer, because of about 100 students, and they do a self-healing project program for the whole semester. 1/3 of the students forget to eat, do not eat breakfast or more. And those who do eat breakfast, often it's lots of simple carbohydrates. Given this interaction of breathing and carbohydrates, you can see that their anxiety increases. The simple lifestyle behaviors for students, of which I'm not going to focus on, I just want to be aware of it. And that is what we often forget, is what I call grandmother therapy. Go to bed at a regular time, get your 8 hours of sleep. For breakfast, have some protein and fats and lots of kind of veggies or other things, and no simple carbohydrates. That's the only thing we do, we see a remarkable improvement in the rate of anxiety and other things. So that's a side note, okay? If I go to breathing for a quick well, let's see what I can think about. We want to teach people how to breathe differently. And what I said earlier, be aware, not just for the 15 minutes, all day long and interrupt. The same is true for posture. So quickly well, all of you, let me do a little exercise, okay? Just for a moment, step away from the computer. I know it's hard to do. You cannot see me. But for a moment, put your body into a defeated body posture. You know how you slouch, you almost curl, you're afraid or fearful. Put your body in that position for a moment. Really put your body in that position. So you're slouching a little bit. Now in this body position, I'm going to ask you to hold that position, and I'd like you to evoke and think of hopeless, helpless, defeated memories. The time we have felt hopeless, and really make it as real as possible. Really evoke that. And hold it, match the body position with that. Really be like an actor. And I'll hold that body position for a little while. Now I'd like you to keep holding the body position just like this hopeless, helpless, defeated posture. And now I'd like you to think of only optimistic, empowering memories. Just evoke those. Don't change your posture. Don't look up. Evoke those. Evoke those empowering, optimistic memories. Good enough for a moment. I can do this much longer. Now I'd like you to shift your body position. Really shift it into an empowered body position. So if you're looking up, the world is looking up, you're almost expanded, you're looking forward to the day, really almost by looking up. And now in this body position, really stand there and do that. I'd like you to evoke hopeless, helpless, defeated memories. Do not change your position. You're still in this empowered position. And now, without changing your position, still being evoke only optimistic, empowering memories, one after the other. Enough. I do. And now you can just sit, at least be wiggled around and move. You can wiggle and move for a moment. That's great. An ideal of what we observe when we do research in that way, what we find is when you are in the defeated body position, it is much easier to evoke hopeless, helpless, powerless memories. If you are in the empowered position, it was slightly easier to evoke the optimistic, empowering memories. When you were in the defeated body position, it was harder to evoke optimistic, empowering thoughts. And when you were in the empowered body position, it was harder to evoke the hopeless, helpless, defeated thoughts. And if you did evoke them, then in fact, you would find that you had more distance. We have published this data many times. So note that body position affects access to memories. It affects by which you get flooded more. And when I think of my students today, that we see such an increase in the anxiety and depression. So now we use these as simple strategies. So let me share a little bit of data. This is, for example, after 5 weeks of being in a class where they learned something about posture, such as the video by Amy Cuddy. I highly recommend that. Or you can look at my blog, pepperperspective.com. There are a number of articles on posture which give the same data. But after 5 weeks in class, where they do daily practices, which is very, so they not only practice for 20 minutes, they also need to translate that to daily observations. Then they report a decrease in anxiety, decrease in subjective stress, and decrease in neck and shoulder discomfort, abdominal discomfort, headaches, irritable, and menstrual cramps. Obviously that's since end of 78. It's only for a short period of time, but for about half the women it works out. They would report their menstrual cramps significantly decrease when they have cramps or dysmenorrhea, and they, instead of curling up, they now elongate and breathe lower. But let me do it by a case example. I want to talk about 2 case examples which will illustrate the concept. So maybe I'll do this because they imply basically the biology. And this is a pattern we see in so many people, whether they have acid reflux, whether they have anxiety, whether they blank out on exams. It makes very little difference. So I'm using this as a case example with the physiology to show it. Okay, here's a 21-year-old young student, has suffered acid reflux since age 6. She has been prescribed many medications and over-the-counter medications. None were effective. Starting college, it became much worse. You could say she has social anxiety then. She really isn't like that, I would say. She should be going to psychotherapy, you could say. There's something going wrong with her. She's limiting her social life. She avoids going out with friends because she worries what she would eat. And if it's spicy, it would cause her pain later. She started to get more anxious, felt depressed because her acid reflux restricted her from living a normal life as a young adult. We have seen so many of these students in these categories. But let's look at the hydraulic model for a moment. Okay, this is what we tend to do with many of the students in a teaching model is take away their symptoms and say, this is really the result of normal biology. It's an exaggeration, let's say, of an alarm reaction. So we normalize it. We don't say you're crazy. We don't say it's psychological. We say your response is really normal. It's like if you are very sensitive and there's a saber-toothed tiger out there, then what you do automatically is you tighten your gut, you freeze a bit. That's normal. And then you would run away, hopefully, and survive. Or as Sapolsky used to say, when faced with danger, why should your body regenerate and heal itself if it's going to be someone else's lunch? And that's a model we use a lot for the students. But if in a biomechanical model, which we can then explain, is here when what happens is, here's your waist. If your waist is constricted because of clothing, because you're sitting at the computer bent forward, that means there's much more constriction in your abdomen. Then that pushes the abdominal content upward against the stomach as well, against it. And then when you inhale, your diaphragm tries to go down. It's trying to compress downward. But if my abdominal muscles are held tight because of fear, are held tight or the area cannot expand because of waist constriction or because of self-image, who would ever want to date me if my stomach bubbled out? And many people have gotten their 5 pounds of COVID increase in weight. So you could say, what is happening? You increase the pressure on the stomach, that then it's like squeezing the bottle, and now the acid goes upward, that leads you to your discomfort. It's a model, but it works great. And and what you then observe in almost all these clients, whether they're anxiety, I would see many people who are not like that, with anxiety, with almost all GI distress, is that they have their abdomen shows almost no movement in breathing. So what do we generally do? There should be an RN procedure. We do an assessment, monitoring breathing, monitoring neck and shoulder tension, looking at heart. Then we often will see patterns. I'll explain that for a moment. We tend to give a biological explanation, an evolutionary explanation that tends to take the onus away. You're more sensitive, you react more. Then we do training. We train in posture. We have them observe how thoughts and bodies are linked, how breathing may affect you. We teach them to transfer and practice. And then you have to practice at home all the time and at work. Here is a classical recording. We have seen so many of these that it's like I can almost predict this when someone walks in the office. In 2 minutes, you can observe them when they're breathing. They either almost like mouse-like, there's almost very little breathing movement, punctuated with sighs or something like that. They often breathe more rapidly. And what is this showing here? The upper line is the chest. This is a strain gauge around the chest. The bottom line is a strain gauge around her abdomen. And you can see basically there's almost no movement in the abdomen. She's breathing. And the movement is predominantly in her chest. And her normal pre-measures, this is done as part of a class project in this case. So the data is not perfectly collected. The students are doing a project. You can see the breathing rate is high, 20 minutes. The person thinks this is normal. And if you had looked at heart rate variability, the heart rate would be higher because it's running on the sympathetic side of the heart rate variability. And you can see that during stress, they start breathing either quicker or they'll hold their breath. Both patterns are very common. And this was the recovery training. We taught her to breathe. She purposely tried to breathe slower, and notice she's only breathing in her chest. We use this picture with the previous picture to point out if you did this, whenever you inhale, the diaphragm still tries to press down, you're squeezing it up, and you're staying highly sympathetically aroused. So what do we teach the person to do? Well, we just normalize it. Wear looser clothing. Now, luckily, many of you can do this now because like I'm wearing some slack. I don't even wear slacks. I wear sweats. You can't see except my top. But then you also have to observe what happens to your breathing and posture when it changes. So when I gasp, what just happened? When I held my breath, what just happened? When I slouched, what just happened? And we use that with feedback. So for the posture, I'll talk about that. We use a posture feedback device you put on your neck, or we use one that uses the camera of your computer. And every time you slouch, it vibrates. And then it reminds you to sit up. Really, what it really will want to do, it will remind you, ideally, to identify what is going on. Is it the posture? Is it that I am looking at the screen more? Is it that I get frustrated? I have hopeless thoughts? Is it that I'm tired? Is it ergonomics? And then you now do behavioral changes to transform this. And then you shift your breathing from thoracic to abdominal breathing. And here, I think I would recommend that the kind of effortless abdominal breathing is more important even, that approximately about 6 breaths a minute, very slowly, than exactly the HRV, because we forget the highest HRV we usually can get if people breathe more in their chest. So when you inhale in your chest, your heart rate really speeds up. And as you exhale, the heart rate goes down, almost paradoxical breathing. So when the person exhales, their chest drops, their stomach widens. That means the diaphragm is still down in some ways. And then when they inhale, they go in their chest again. Then you get really great HRV. However, we need to have the movement in the diaphragm going up and down. And that can only easily occur when the person inhales and it transfers and the oblique muscles relax a bit, the pelvic floor drops a bit on the inhalation, and they retighten in the exhalation in the vertical position. You don't know you're doing that, but that's what's happening. And that process acts as a pump for the whole abdomen. And people really forget that breathing is not just gas exchange, it's also a lymph and venous blood pump. So when I breathe more diaphragmatically that way, in which my abdomen expands and comes in, just like in a little baby's stomach, then each time I inhale in the vertical position, I'm reducing the intra-abdominal pressure. The veins can fill, the lymph vessels can fill. When I exhale, it increases the pressure. In fact, my vena cava will decrease in diameter by about 1 centimeter, and depending on how big you are, or tall you are. And when you inhale and relax, the vena cava opens up a bit. So that system is really flexible and reduces the strain on the heart. It increases significant circulation in the abdominal area. It will tend to reestablish peristalsis, etc. Okay. And then, so that's what we talk about. She kept a record. And now what happens? This was done later. That's a year later when she came back for doing the post for fun, because this was part of the class. Now when she is relaxed, take a look. Look at the difference. It's like how she now has learned how to breathe in her stomach. These are very easy. There's no heart rate variability measure here, but it would have matched very well. When she thinks stress, she still reacts. She's a healthy person. Stress should make a reaction. If your body didn't change, you wouldn't feel stress. So she still reacts, and then she can really recover. Now, what happened to her? Well, let's look at the symptoms. Nausea, constipation, bloating, heartburn. This is basically, she has been a child. It's, from my perspective, many of these symptoms, anxiety, GI distress. If we do this kind of approach, it's just one follow, then we did a follow-up on her. What she did is the cue of worry to, and the breath holding, she interrupted that pain cycle and focused on self-healing. Whenever she held her breath or felt that she was about to have an episode of acid reflux, she calmed down, focused on her breathing, and keep it, she used her hand on her stomach. She wore looser clothing. And then she became aware of slouching. She would become erect. But more importantly, she had observed that when she started to slouch, she was either tired or started to have sort of self-critical thoughts, picking on herself, in negative thoughts. She would then implement the cognitive change. And the result was she could now eat foods that previously caused irritation. It's most remarkable. And she has been symptom-free. The article has been published, by the way. And if you go to my blog, pepperperspective.com, you can see, put under acid reflux or put under irritable bowel. There's a great, they both have also the interviews with the students to give you a flavor of what the experience is from their side, from the client's perspective. This perspective, I've been so impressed about. 3 weeks ago, I got a referral, for example, to do biofeedback with a 33-year-old woman, very successful woman, massive anxiety, was on medication. And when I talked to her, she was almost just like this. No movement in the abdomen, tight chest, stomach discomfort, neck and shoulder tightness. Basically, we did something very similar with her. And I must say, she really practiced. I just saw her yesterday. 3 weeks, that's the third session. Her abdominal discomfort has disappeared. Her anxiety has dropped by 60 to 70%. She also included a diet change. She now eats breakfast. You know, very simple. But the key is to identify when the first trigger occurs and interrupt that. Maybe I should show, I realize I've talked for a while. Let me just see where I want to go, which may be useful. Let me give you one experience that some of you may not know, how quickly breathing can affect you, if that's okay. Oh, let me do one more moment, and then I'll do that, okay? Here's a person, a student with chronic headaches. I love student examples, but they're not simple. This could be your client. 32-year-old female, chronic headaches, labeled migraine by her physicians since age 18. Not successful. She kept having headaches every week. She took 2 to 10 Excedrin tablets a week. She labeled as migraines. I don't, as a biofeedback practitioner and faculty, I don't label it that way, but I perceived it was much more tension headaches. And what did it focus on? Well, it started for her at age 18, really, when she first went to really start using screens much more, because then your head goes forward, you tighten your neck. What did this was done in 5 minutes, literally. It's shocking to me. I asked her, she came to me and said, I have a, you know, I may have to leave the class because I have the headaches, blah, blah, blah. So you could see she shifted her, she was breathing only in her chest. You know, so we taught her sitting next to us in the class how to breathe abdominally. We taught her how to do her posture retraining. Later on in the class, we monitored her neck and shoulders because she was a participant in this class. And when she thought she was relaxed, the trapezius muscles were high. That's so common. She did not know that they were not relaxed. Then she was asked to drop it till she could see on the screen by the noise, now I'm relaxed. Oh, she was totally surprised. Then the whole class had to do a practice. That's to use an app on her computer that provided visual and auditory feedback every time she slouched. So it used the camera. So when sitting at the computer, every time she would slouch, the camera would identify her slouching. It would give an auditory signal. For her, she could then identify her thoughts, her emotions, what she was doing. And for some of it, it just meant I need to change my screen height. For others, it means I'm tired. I need to move and wiggle. For others, and for her, also her internal language. And then to breathe low, we taught her how to do it. What was the result? Well, to my own surprise, that's why we wrote it up, obviously, you know, she became totally headache-free and no medication after the first day of coaching. 7-week follow-up, that's what it says here. We now have a year follow-up. She continues to be headache-free and reports a significant reduction in shoulder pain, back pain, depression, anxiety, improvement in motivation. This is what the app did. You can also do it with a device called the Upright Go, which I assign now to many, many of my clients, because when you are collapsed, you have much more access to hopeless thoughts. And I think therapists make a big error in their office, because when you put a person in a nice reclining chair, you sit slouched. That body position allows much easier access to hopeless thoughts. We're trying to teach people that more and reframing of thoughts. It's much harder to do. And so if you can be upright, that means changing your furniture. It means putting a pillow at your mid-back. It means not sitting on your couch watching, streaming videos while being slouched. There are many other strategies to do. It makes a significant difference in mental and physical health. If you look at what she did, she became observant. What were the reasons? Computer tasks, crossing legs. She's a woman. When you cross your legs, a defense position often, or an adaptation that the chair is too high, tiredness, negative. And each of these became triggers during the day to change behavior. And she used the app every time she opened her laptop at home, 3 to 5 times per day. If she felt the beginning of discomfort or thought, she would take medication. And in the past, she would take the medication. She would adjust her posture and breathe. And out of that, she identified all these things. And this was the effect of the posture feedback for her. Her eye strains didn't change because she did not really interrupt her looking at the screen very much to alternate looking far away. Her shoulder pain significantly decreased. Her back pain almost disappeared. She reported no more depression because when you're up more, her anxiety decreased and she felt more motivated. Let me, as I've been talking for 35 minutes or 30 minutes approximately, and I should ask you all to do something. Just for a moment, get up, stand up again. Just stand up. I know it's hard to do. Our chairs are glued with Velcro to the, our bottoms are glued with Velcro, but just stand up. And now I'd like you just to skip in place. Just look, just skip, look up, look to the ceiling. I know that people around you will think you're a little strange, but just do it. And then rotate, look, really go up. And as you reach, really, way up, and then way up, move. And you can roll your shoulders. And now for a moment, just tap yourself. You can even make sounds. And even tap your head for a moment. And now wiggle around. And once again, sit down. And just ask yourself, after this little movement, did your energy go up? We have sitting disease. We need to integrate movement during the day. And finally, why integrate posture feedback? Well, we know it's nonverbal communication. If I'm empowered, it changes. Your posture changes your hormone productions. It changes your muscle tension, the blood flow to your head, the breathing, the heart rate. It impacts cognition, moods, and recall. I can demonstrate all these from research studies. The sense of felt powerlessness and impacts social connectiveness. Do you walk like this? What are you telling? And we start much too early now. We're looking. We don't want to do that anymore. And this is how people do at times do therapy. Look at the collapsed position. I want to underline, if he were erect, his brain would get different blood flow. The contraction he gets in his neck here may impact some slight blood flow to the brain. Imagine if he was way up erect, he could breathe lower. In this body position, it's much harder to breathe. It's almost impossible to breathe diaphragmatically. His heart rate variability will be less in this body position versus when he could be sitting upright. I may have a slide of that as well. I'll end, I think, in one experiential exercise for a moment. I've talked about posture for a moment. I want to summarize that to say it's much more important than we think. It affects others and it affects ourselves. You could argue that when we take a collapsed posture, we evoke those positions of powerlessness and hopelessness, which we evoke every time we use the cell phone for a long time period. Remember, students, the last thing they do before going to bed, and many of us as well, we look at our cell phones, and then when we wake up, we scroll and do the same. At least be screen-free a half an hour or an hour before going to bed. That's one. 2, teach clients lower, slower diaphragmatic breathing. Let me do one little exercise with all of you to show the impact. We forget the power of this. In a moment, I'm going to ask you to exhale 70% or make it 50% to make it easier for you of exhalation. What I mean by that is you inhale normally. I don't care how you do it. Then when you exhale, you only exhale about 70% of the previous inhaled air or even less. Then you inhale normally. Again, you only exhale about 70% of that air you inhale. Keep doing that and keep doing that and keep doing that. Are you ready? So let's start and do it right now. Begin. So with each breath, as you exhale only about 70% of the previous inhaled air. Each time exhale only about 70 or even half of the inhaled air. I think that's enough. And now ask yourself, how do you feel? What are you experiencing? And when you do this with healthy people, you get something like this. If you rate their feeling of a sense of anxiety. Before, I had very little. After 30 seconds of breathing this way, I have an increase in anxiety. I often get lightheadedness. I may get dizziness. Some people get many heart palpitations. Some people, it's only feeling breathing out of air. And then I recover again. Yet if I had looked at you as a person, you would not have changed at all. I would never have known you breathe this way. But what we use this way, I call it symptom prescription. If your symptoms you have, anxiety, whatever, increases by doing such a little practice like this, and here are the symptoms people would get statistically. If any of these symptoms, that means that your breathing pattern is a cofactor in the etiology of your disorder. And therefore, by reversing your breathing and not breathing in this way, your health will be improved. And the same thing would be true with posture. I can keep going for a long time, but I realize maybe people have questions, and I think we should just move to Q&A. And to remember, these are very simple approaches. The posture changes, the breathing. However, it's to be done during the day. I'll end with one more practice, and then I have questions. I'd like you just to sit, look with your head, keep your head straight ahead. And now for a moment, I'm gonna make a noise, a clap. And with each clap, I like you to look to the extreme right and then to the extreme left with your eyes, not the head stays steady. So when I hear a clap, my eyes look to the right, like the scan, and then the next clap to the left. Are you ready? Get set, go. And are you holding your breath? And if you're like most people, you probably held your breath and you did that vigilance. You just gave a mini alarm reaction. So finally then, observe where you hold your breath, where you shallow breathe, where you slouch, and then use those and train them to shift and change your language and position. Questions?
All right, we're going to get everybody unmuted. That'll take us a minute, so I'll start off by just sharing some personal examples with you.
Great.
Posturally, I think I have had sciatica, which has been resulting from pushing one of my vertebrae pushing on one side of my, my nerve. And if I sit for too long of a time, that pain comes back, especially if I'm not sitting properly. And while doing your exercise, after we were done, what I did is I hooked myself into a blood pressure cuff and then did more deep breathing and just watched my blood pressure go from an okay level to an even lower level just by deep breathing.
Great. Yes. I mean, it is a classical protocol, in fact, where what you do is you have people breathe, and you can do the inverse also. You have them just be normal, then have them take the blood pressure. Now have them talk stressfully, a little aggressively, take the blood pressure, and then look at the recovery. And people who have labile or hypertension, their blood pressure will go way up. That's a classical minute assessment you can do. And the opposite side is when you're following this, you do the very slow breathing where the person doesn't quite try to do it, but does it. Blood pressure almost always goes down, especially as the diaphragmatic and the lower abdomen expands. In our experience, when you do the breathing where you allow the lower abdomen widening, the blood pressure drops and you have much better success than if you do it other ways. But we don't have systematic data on that. Great.
All right, well, I think we've got everybody unmuted, so I'm going to let other folks take questions for you, Erik.
Great.
Dr. Peper, could you please repeat what you mentioned about collapsed posture leads to, it was helplessness, I had a hard time keeping up, it was helplessness, there was something else about collapsed posture.
Okay. If you look at the physiology, I mean, I could show slides, but if you look at the when I start collapsing, right, just sit back, now let yourself slouch and you collapse. you could say in many ways that posture is a kind of defense reaction, right? If you look at like our shoulders roll slightly forward, our abdomen now doesn't have much movement anymore. It can't. If I'm fearful, I tighten my abdomen. Otherwise, if I'm depressed, it's just soft often. And then, but however, in this position, if you breathe, what you really see is the movement of breathing is really more above the belly button and much higher. So it's shallower and going up. Okay, that the person breathes much more shallowly. And in this body position, at least in our research, and people have demonstrated with many different ways, that if you now take this body position and you ask someone to recall hopeless thoughts, helpless thoughts, hopeless, helpless, powerless, defeated thoughts, it's very easy for most people to get captured by them and evoke them. In the same position, in slouching, you ask the same people to evoke empowering, positive thoughts. It's more difficult. That data is overwhelming. And my colleague Yimei Ling in Taiwan, we record the EEG as well. And then you can compare where has the brain almost to work. Does the brain, you see more brain activity? The brain has to work much harder when you're slouched and you're trying to think positive thoughts than when you're up and you think positive thoughts. And so before doing any therapeutic strategy, what one of the most useful studies we did, I think, was comparing essentially kind of mindfulness, letting go, or cognitive reframing strategies compared to posture change, breath, and cognitive reframing. We published it with Danny Hamil, I think 2 years ago. And what we then show is that if I ask you to think of a stressor, really capture it where you want to talk yourself out of it, if that makes sense. So you evoke the stressor, then do your cognitive reframing. That's one condition. And then the other one, you ask the person to think of the stressor. And then first shift position, sit upright, take a lower breath, look up, and then do the cognitive reframing. The data is overwhelming. That the cognitive reframing, the posture, breath, cognitive framing is much more effective, way or more order of magnitude more effective than trying to do just the cognitive reframing.
Can I please talk you into sending us that paper, please? That sounds awesome. I want to forward that to my colleagues.
I'm trying to think. I don't. Yes, I can send it to you, or if you just send me an email.
Eric, this is Rob. Just email it to me, and I will put it on our listserv, and everybody will get it. Okay,
and
perfect.
if anyone wants to know more, I mean, all these studies, most of these studies have also been written up as blogs in my blog pepperperspective.com, and also it's in our book. In fact, many of those called techstress, which was done by myself, Rick Harvey, which for the public has many of these practices and strategies to improve, which I would think would be helpful for many. But I'll send the article to Rob. It was published in Neuroregulations.
Thank you.
We'll post it. Thank you.
Other questions? Uh-oh.
I have a question about
Sure,
vagus nerve and the heart rate, the breathing. How are those things affecting each other?
Well, the classic work would be, I mean, I think from this world is by Paul Lair and Dick Everts and others, and they would say that you have a natural cardiac rhythm, right? The vagal activation going. So you have the heart, when the vagus pulls out, the heart rate goes up, and then the vagus comes back, the heart rate decreases, and this gets amplified by essentially by using breathing at your what people call resonant frequency, where you inhale approximately 6 breaths a minute, 5.5, 6.5, depends on your size mainly. Then what happens is that as you inhale, your heart rate speeds up, and as you exhale, your heart rate slows down. So you could think of it that doing the inhalation is activation. It's really more vagal. It is not yet real true. The hormonal level of sympathetic activation, that takes much slower curve. But when you inhale, heart rate speeds up, and then when you exhale, heart rate slows down. And that is modulated with the vagus. So I'm not explaining it much more than that. And when you can now look at that and you have people breathe at that rhythm, you can measure something called heart rate variability, which I think, that has been explained before. You get a numerical value, and what you see with patients, most patients who are anxious it's never all, their heart rate tends to be higher, as if they don't, the heart rate doesn't recover because they're breathing more quickly and shallowly. On the other hand, so that's one arm of it, they're sympathetically activated. And if you're exhausted, then the heart rate is not able to go up very much. You can't activate. That is the part you use also in sports. So when you work with athletes, after if you keep that measure, you look at heart rate variability when they're healthy and in good shape, you get a kind of index. How much is that heart rate variability? And then let's say their heart rate goes, if you looked at it for simplistically min-max for a moment, it goes from 40 to 60 or 40 to 70 for some of the athletes in the min-max, can be very high. Now, after they have done competition the next morning, if they're exhausted, that is significantly less. And that would tell you this is not a day to keep pushing the athlete. They need time to regenerate. And many people are very poor at regeneration. They do not, we live in a world where we don't easily listen to ourselves. And then you have the interaction of thoughts affecting, if you worry, then also that would affect the heart rate variability. I didn't explain it well, but that's the simplistic way for me doing it. Does that make sense to you?
It does. Thank you very much.
So to go back on heart rate variability, we use these monitors all the time. And then you show when the person is sitting quietly and they slowly get the heart rate variability. You can see this nice up and down. I usually have a graph where I show both heart rate and breathing. And they co-vary sort of together, and they don't always for people, and that's other. And then you have the person think of a stressor, and you see their breathing really shifts quickly, and the heart rate variability decreases in most cases. And if you happen to, ideally, you should not just only use the EKG for heart rate variability, you should use the pulse amplitude on the finger. If you do that, then what you can see is that sometimes heart rate variability can go pretty well, but the pulse amplitude, that you could say the vascular contraction increases, so the hands almost get colder, so you see a decrease in the amplitude of the heartbeat. And if someone has PTSD, that's the work by Yuval Odad and others, then what you see is as you evoke that stressor or that cue, yes, you have decrease in heart rate variability, that often comes back. However, the pulse amplitude doesn't come back. So the blood vessels stay constricted. To me, that is a much more useful measure often of emotional tone. So I often will look at heart rate variability to see how almost the person reacts to stimuli or processes them internally. And I find that more sensitive in many cases clinically or educationally than the HRV. But no one almost does that. But I think it's a missing measure, and I think would be very useful. And if anybody works with people with PTSD, then you see often once it's triggered, you see the blood volume, pulse, amplitude, they go down, and it may stay down for 20, 30 minutes. It doesn't come back. Although most of the other measures seem to come back. And then you want to train the person, because really when you feel safe inside, think about it, your blood vessels, you tend to feel warmer, your hands warm up usually, depending on the external temperature. Think of the terms, we glow when we feel peaceful. And that's what you want to do. That's almost, if I think about this world. So I cannot conceive doing neurofeedback without teaching people breathing first. I could not conceive doing neurofeedback without looking first at the diet. Is the person drinking lots of coffee, taking drugs, and in terms of their diet, are they on a glycemic diet and drinking power drinks and sugar? If they are doing that, they are continually alternating into hangry states, paradoxically. And for a subset of people with epileptic seizures, when you start changing those behaviors, you find the seizures disappear or decrease significantly. And it's much quicker to do that first. I call that, for any therapeutics, you want to stabilize the biology first from an evolutionary perspective. That means sleep, diet, some exercise, breathing, and then we go to the more complex stuff. It's not that it's easy at all. And I'm equally unsuccessful with many, with other students as well. I gave you hopefully some useful examples. It may be useful if you want to get a perspective. Look at the blog. You may want to look at one of the blogs we also wrote as a scientific article on irritable bowel. You'll see both the person describing what they did, as well as, in the acid reflux, and the one about the headache I described of the student. She also did an interview and describes her experiences, what she really did. And I use this usually as motivators for other clients as well.
Erik, I have a quick question, because I know we're getting to the top of the hour. Given the population of students you work with since you're at a university, I'm just curious, if you were going to pick out one lifestyle factor, one or two lifestyle factors that you think most negatively affect people from the perspective you've talked today, what would those be?
There are 3 or 4. One, much excessive sitting watching screens.
Yeah.
Almost all, whenever we have students who are depressed or anxious, when we do a self-healing project and they modulate their own screen, social media, they end up doing much better. That's one. 2, diet. I mean, I hate to be pragmatic. I live in a world at university where we live, our population are a lot of minorities, people of color, people whose both parents work, the people never had skills or family skills to eat breakfast, lunch, or dinner. They often have to eat by themselves. Many skip breakfast, many eat horrible foods. So I would say, for anybody who's anxious, you need to eat, being pragmatic, eat protein and some fats for breakfast. Really cut down simple and complex carbohydrates. Eat lots of veggies. For half the students, when they do that, their anxiety decreases significantly. 3, they need to learn slow diaphragmatic breathing. There's no issue. Under stress, people breathe thoracically, they hold their breath. When they learn to practice that and do it in face of stressors and then do timeout, it is remarkable. 4, sleep, right? I'm not talking anything else. Sleep. I just had a student, I couldn't believe it. No, I do believe it. I had a student who was complaining horribly. Her self-healing project was to improve her sleep because she has no energy during the day. She really feels exhausted. She goes to bed some nights at 3 o'clock, some nights at 2 o'clock, some nights at 1 o'clock. Totally irregular lifestyle. For 1 week, her practice was to go to bed at the same time and wake up 8 hours later. Good luck, right? But she did. And then eat breakfast. She couldn't believe the change. So I believe, do an experiment. Don't say you have to live this way all the time. Do an experiment for 2 weeks. And if you do that, those are critical. And then you have obviously the importance of social support and movement. Every half an hour, get away from your screen. Look outside. Look at the lovely trees. Well, good luck if you have them, because we're going to have an epidemic, a massive epidemic, which we're already having, of people being myopic. If you go to Singapore, 80% of junior high school students and high school students now need to wear glasses. And why is that? As little babies, as little kids, they are using screens, their walls are nearby, their eyes really remodel. We forget structure, function, develop structure. If I only look at near surfaces, my eyes eventually adapt, and that near surface becomes a new focal plane. And that means I get an increased risk of myopia. I get an increased risk as I get older of attached retinas, and I get an increased risk of, what's the other one? When the central fovea starts breaking down. I forgot. I can keep going, and glaucoma.
Yeah. Well, we're close to that top of the hour. That's excellent. Richard and I did a pilot study, then he continued it with graduate students at University of North Carolina, Greensboro, and found similar factors like you're finding, poor sleep, high stress, poor diet. But the whole vision about eyesight is really quite interesting. And I was noticing that watching a show on TV with all these young people, they all had glasses on. I thought, that's really odd. They all have glasses and they're like teens, it was crazy.
Yes,
well, we're at the top of the hour, and I don't want to keep you too long, but did anybody have any last questions for Erik before we wrap this up?
There was one question that came in from an attendee. They're asking, are there wearable gadgets you like for HRV?
There you go.
I don't. The one I don't use that. The one I have used, not for HRV, by the way. I mean, no, I still use it. I mean, pragmatically, I often loan. I have tons of stress erasers, so people use those for home practice, and I do that because I happen to like the somehow the software built into that little device is very nice. I sometimes use an audio files, very simple pacing. To me, that I want to teach people two things. I want to keep going back to that. One, observe the situations where you gasp or hold your breath. Those are the stressors during the day. Once you make a log of that, what are they? Some, and then ask, how can I behave differently? Some I can just breathe easily with, that's unnecessary because I'm hypervigilant. That's one. I think two, practice lower, slower diaphragmatic breathing. That means now you go against all cultural domains. Your stomach needs to expand. And for people who have had abdominal surgery, that's very difficult. Because what you learn in medicine, people who get abdominal surgery shift often to more shallow thoracic surgery. They don't know they're doing it. It's called learned disuse. Because when you have an abdominal surgery, whatever it may be, a hernia repair or whatever, you learn to protect that area. You tighten slightly or not move it, and thereafter you keep breathing in that way, and you maybe 30 years later you still breathe in this new way. There are many other reasons. So I tend to want to focus teaching people more on slower breathing. And the device I use a lot for posture is the one I said earlier. I get no money from this company, so I want to be clear. It's called the Upright Go. And I find, it takes a little while to adapt it and make it work for the person. If I can persuade a client to wear an Upright Go on their shoulder, on their neck, and then use it every time they slouch and vibrate and they interrupt themselves, I am in awe of what can happen for a number of disorders, because you could say I do this defense reaction, which is a cofactor in numerous disorders from neck and shoulder pain to GI distress.
All right. Well, we'll wrap this up, Erik. Thank you so much for your time today. Folks, I really encourage you to take a look at Erik's blog. There's lots of great information on there. And once he gets the handout sent to me, I'll put that on our listserv. So thank you so much again, Erik.
Thank
you.
you.
Have a great day out there in the
Inviting
West
me. It was
Coast.
my pleasure. Hopefully it was useful. And I'd appreciate to hear from the participants what they found helpful.
Great.
Please send me an email to epepper@sfsu.edu.
All right.